Hi, I'm Brooke MacNab to do a video head-to-toe assessment. I'm going to begin by showing the room. Okay. So before entering the patient room, I'm going to make sure I've washed my hands, and then I'm also going to wipe the bell and the diaphragm of my stethoscope with an alcohol wipe. Hi, I'm Brooke MacNab, a practical nursing student from Seneca College. I'm here to do a head-to-toe assessment on you. Is that okay?
Yes.
Do you have a preferred way to be called?
Rachel's okay.
Okay. For patient privacy, we close the door and the curtains. The temperature in the room is comfortable. Do you agree?
Yes.
And do you have to go to the bathroom before we start?
I'm okay.
Okay, good. So we read in the chart that the patient is a 15-year-old female and her appearance and sexual development is appropriate for the age. Looking at her body, she has proper nutrition, good posture, there's no obvious physical deformities, and her body's symmetrical. Her face, the facial expression and mood are congruent. Her dress and hygiene are appropriate for the occasion, and she's maintaining eye contact. So can you stand up, please, and walk towards the camera? Good, and then back towards me. Good, and you can take a seat. So range of motion is good, and the gait is balanced. Rhythm is good, and yeah. So there's no signs of respiratory distress. The work of breathing is unlabored. What's your name?
Rachel MacNab.
And where are we?
Aiken, South Carolina.
Good. And what time is it?
Around 3 o'clock.
Good. So the patient is alert and oriented ×3. So moving on to the head, we're inspecting and palpating for any lesions. Felt, there's none felt, or masses, no swelling. Is there any pain with this?
No.
Good. We're inspecting the hair. It is thick and evenly distributed. No signs of infestation. Palpating the face. Good. No masses or lesions. Physical deformity. Face is symmetrical. Was there any pain palpating the face? No. Okay. So, moving on to the eyes. So we have a white sclera. Pupils are equal. The iris are blue. Conjunctiva, we're looking for pink, and look that down. Good. Lashes are evenly distributed. There's no discharge or crusting. So we can test for cranial nerve number 7. Cranial nerve number 3 is a direct and consensual light reflex. So we're going to go into this. Good. Looking for the light and both spots on the pupil, which was correct and in on this side. Good. Can you please follow the pen into your nose? Good. The eyes are accommodating, so we can say that the pupils are equal, round, reactive to light, and accommodate. So cranial nerve number 3 is intact. Going back to cranial nerve number 7, which is the facial nerve, we can test for. Can you smile, please? And show your teeth. And frown. Good. And lift your eyebrows. And shut your eyes tightly. And puff out your cheeks. Good. So all symmetrical with no legs. So we can say cranial nerve number 7 is intact. Now moving on to the ears. So we're looking. There's no discharge in either ear, and they're both symmetrical, and they are evenly aligned on her head. Now we can palpate for the auricle and the tragus. Is there any pain with that?
No.
Okay, good. We're going to perform the whisper test, which you would whisper, but for the purpose of the video, I'm going to say out loud. Keep tragus, good job. And repeat after me, okay? A A2D.
A2D.
And 3D4.
3D4.
Good. Moving on to the nose is midline, symmetrical, no masses or lesions, no crusting or discharge around. We're going to palpate the frontal and maxillary sinuses. Was there any pain with that?
No.
Good. Moving on to the lips and the mouth. So we have her lips are pink, they're hydrated, there's no lesions. Looking at your teeth, they're white, they're very straight. Did you have braces?
Yes.
Good, and open. No signs of dental repair. Is that true?
Yes.
Very good. Now look at your gums, please. Good. They're pink, no bleeding, no lesions. Looking at the tongue, soft palate and hard palate. Open. Is pink and midline, no lesions on the tongue. The soft and hard palate also pink, the membranes are intact, and there's no lesions. We're going to test for cranial nerve 9 and 10. Okay, open please. Say ah. Good. So the uvula and the soft palate rose when the patient said ah, so we can say cranial nerve 9 and 10 are intact. We said before that the tongue is midline. Can you do move your tongue from side to side? Good. So you have lateral deviation. And can you repeat after me? Say light type dynamite.
Light type dynamite.
Good. So you can say cranial nerve number 12 is intact. Moving on to the neck. You see the trachea is midline. There's no obvious masses or lesions. So there's no obvious thyroid enlargement. You're going to palpate for the carotid artery. Good. Good. So the rate and rhythm are equal bilaterally 2+. And just expecting. We're going to test for cranial nerve number 11. Can you look to the right, please? Good. And back at me to the left. Good. And back. Good job. And your chin to your chest. And then can you reach your shoulders, please? Good. So cranial nerve 11 is intact. Moving on to the upper extremities, we're going to inspect with no involuntary movements, masses, or lesions. The hair has equal distribution bilaterally. You're going to palpate, no masses. The temperature is warm, and the joints, no inflammation in the joints, edema, and joints same temperature as the rest of the body, or as the rest of our arms. So we're going to test range of motion in the fingers. You do flexion and extension, and then we're going to move on to your wrist. So flexion and extension and radial deviation, ulnar deviation. Good job. Now your elbows, flexion, extension, and your arms out like this. We'll go supination and pronation. Good. You stand up, please. Abduction and adduction and external rotation, internal rotation. Now you can take a seat. So the range of motion is good in the upper extremities. We're going to look at the capillary refill on our fingers. Less than 2 seconds. This hand. Equal on this hand. The nail beds are pink. We're going to test for the radial pulses, which are equal bilaterally. 2+ in the rhythm is good. Can you see the finger, please? So the strength is equal bilaterally. Moving on to the lower extremities. Looking, there's no involuntary movements, no masses or lesions. swelling in the ankles where it typically would be. Palpating. There's no lesions. No masses. Temperature. Warm. No swelling in the joints. And the joints aren't any warmer than the rest of the legs. I am gonna palpate for the dorsal pedalis pulse, pedalis pulse, and they're 2+ and equal bilaterally with good rhythm and rate. And now the posterior tibialis pulse, which are 2+ and equal bilaterally. Now testing for the dorsal and plantar flexion. So can you please push up? Good, with resistance, and then push down. Very good. Okay, can you swing your feet this way? I'm gonna lift your shoulders, okay? Yes. Good. So looking at the patient's back, there's no sign of skeletal deformities. It's symmetrical. The membranes are moist and intact. We're going to palpate. No masses, no tactile firmitis. Is there any pain with that? No. Okay. Now auscultating with a full cycle of breathing, 1 in and out, with each listening at each site. Breathe in and out. Good. Comparing both sides. Listening for no adventitious sounds. Good sound bilaterally from C7 down to T10. Also listening laterally. Good. So we can turn back this way. We're going to listen to anterior breath sounds. Listening to both bronchovesicular and vesicular sounds. Yeah, please. Also listening laterally. Okay. So, no adventitious sounds in the rate and rhythm of breathing are good and equal bilaterally. So now auscultating for the heart valve sounds on the right side of the sternal border at the second intercostal space. We can listen to the aortic valve. On the left side of the sternum at the second intercostal space, look at the pulmonic valve. At the third intercostal space, listening to the Erb's valve. At the fifth intercostal space, listening to the tricuspid valve. And at the fifth intercostal space, mid-clavicular line, you can hear the mitral valve. Listening for no extra heart sounds and with good rate and rhythm. Yeah. So now we can move on to the stomach, abdomen. Good. So we're looking here. The contour is flat. There's no abnormal pulsations. The umbilicus is midline. No obvious masses or lesions. And the skin is intact and hydrated. Auscultating first as to not disturb motility of the GI tract. We're going to listen to the right upper quadrant, the left upper quadrant, the left lower quadrant, the right lower quadrant. Then we're going to palpate lightly, 1 to 2 centimeters. 1 centimeter is appropriate here. Feeling for any superficial masses, none felt, no distension, no rigidity. Is there any pain with that?
No.
Okay. And now palpating the bladder. No distension. Is there any pain?
No.
Good. Okay, thank you. Yeah, you can put your shirt down.